Welcome to Final BDS Made Easy. Facebow is a very important topic from the subject of Prosthodontia for your final year exams. This answer is prepared from nallaswamy if anybody would like to refer. Starting with the introduction, a Facebow is an essential dental device used to accurately record the spatial relationship of the maxilla and/or the mandible to the temporomandibular joints. This relationship is then transferred to an articulator, allowing for precise replication of the patient's jaw movements. According to Snow in 1802, it was defined as a caliper-like device which is used to record the relationship of the maxilla and/or the mandible to the temporomandibular joints. According to GPT, it is defined as a caliper-like device which is used to record the relationship of the jaws to the temporomandibular joints and to orient the casts on the articulator to the relationship of the opening axis of the temporomandibular joint. Parts of a Facebow are U-shaped frame, which is the main structural component, large enough to extend from the temporomandibular joint region to a few inches anterior to the face. It records the plane of the cranium. Second is the condylar rods. Small rods at the end of the U-shaped frame that contact the skin over the TMJ region. They help to locate the hinge axis of the TMJ. Variants include earpiece types that fit into the external auditory meatus. Third part is the bite fork. It is a U-shaped plate attached to the occlusal rims during orientation relation recording. It is inserted into the occlusal rim typically about 3 mm below the occlusal surface. Fourth part is the locking device. It attaches the bite fork to the U-shaped frame, supporting the Facebow, occlusal rims, and casts during articulation. Includes a transfer rod and a transverse rod with an auto-adjusting assembly. Last part is the orbital pointer. It marks the anterior reference point, that is, the infraorbital notch, and is locked into position with a clamp. It is present only in arbitrary Facebows. Coming to the types of Facebows, it can be arbitrary, which is commonly used in complete denture construction. In these kinds of Facebow, hinge axis is located approximately using reference points such as 13 mm anterior to the auditory meatus. They include the earpiece type, fascia type, and Hanau Facebows. Kinematic or hinge Facebow, it accurately determines the true hinge axis of the mandible, but it is used mainly for fixed partial dentures and full mouth rehabilitation. It requires a fully adjustable articulator for precise movement replication. Talking about the procedure for using a Hanau Facebow. First step is patient positioning. Seat the patient comfortably with the head upright. Mark posterior reference points 13 mm in front of the auditory meatus. Second step is bite fork preparation. Prepare the maxillary occlusal rim to receive the bite fork. Insert the bite fork with softened alluvax into the patient's mouth. Third step is assembling the Facebow. Position the U-shaped frame with condylar rods on the patient. Lock the condylar rods at the posterior reference points. Fourth step is making final adjustments. Insert the occlusal rims into the patient's mouth and ensure proper alignment. Lock the stem of the bite fork to the transverse rod. Use the orbital pointer to mark the anterior reference point. Last step is to transfer to the articulator. Remove the Facebow assembly and position it in the articulator for precise cast orientation. The Facebow is a crucial tool in prosthodontics. It enables accurate transfer of jaw relationships to the articulator. This ensures that dental restorations are fabricated with precision, leading to improved function and aesthetics for patients. Thank you for watching. If you appreciate this video, do hit the like button and please subscribe to my YouTube channel. Stay tuned for more such videos.